Hey everyone, just waiting for some people to join. Hi there, thanks for joining. We'll give it about one more minute and then we'll go ahead and get started. Welcome. Thanks for joining, everyone. All right. Hi, everyone. I am Dr. Kapadia. I am a physical medicine and rehab specialist at Pelvic Rehab Medicine in Dallas, Texas. And it is Endometriosis Awareness Month. And so today I'm going to be talking about post-endometrial excision guidance. So what happens after you have had a diagnosis of endometriosis and you've had surgery to remove or excise that endometriosis. So first, I just want to start off by saying that endometriosis is extremely common. About 1 out of 9 women are unfortunately diagnosed with endometriosis, but not many people like to talk about it. And so we're trying to create an awareness of it and make sure you know that you are definitely not alone in this. And so what is endometriosis? Endometriosis is basically the uterine lining is normally called the endometrium. When similar tissue grows outside of the uterus, it can be anywhere in the body, but most commonly in the abdomen or pelvis. When that lining grows outside the uterus, it's called endometriosis. And it creates inflammatory changes in your pelvis, causing little lesions called endometriomas or endometrial plaques. And this can cause significant inflammation throughout your pelvis and ultimately leading to significant pain and dysfunction. And that pain can affect all realms of your life. It can affect you from getting your work done. It can affect you in your leisurely activities. It affects 3 major functions in our bodies: bowel, bladder, and sexual dysfunction. And so when that happens, it can really impact your physical, emotional, mental, social lives and really cause debilitating pain. And so the only way we truly diagnose endometriosis is through a laparoscopic surgery, where the surgeon will go in and make small incisions and look for that endometrial tissue. And if they're able to see it, there's 2 ways they can remove it. There's an ablation surgery and then there's an excision surgery. We support mostly excision surgery because it's truly the way you actually cut that tissue out rather than burning it off. And cutting it out and removing it, sending it off to get biopsied by pathology can really help to confirm that diagnosis, but it can also reduce your risk of recurrence in the endometriosis. That doesn't mean that an excision surgery won't result in a recurrence of your endometriosis, but there's definitely less chance of that recurrence. However, when you have that removed, your surgeon ideally should not tell you that removing the endometriosis will cure you 100% and you won't have any more pain after surgery. Unfortunately, that's not the case. Only about 50% of women who have an excision truly emerge from surgery with complete resolution of their symptoms. The other 50% really struggles with post-surgical pain and post-excision dysfunction. And so that is really what I want to touch on today is what do you do after surgery? So you've just had an excision surgery, you're going home, you're initially on pain medication, so things feel good. Maybe a month or 2 will pass, and then a lot of women will notice that their symptoms return, whether that be bowel dysfunction, constipation, pain with intercourse, pain with sitting, cramping, painful periods. a wide variety of pain can return after that excision. So why does that happen? It's because the surgery itself has caused more inflammation, scar tissue, adhesions where things kind of stick together in the pelvic floor. And also the endometriosis having been in your body for so long, it's caused a lot of residual nerve inflammation, residual muscle tightness. It's caused what we call pelvic floor guarding. And so where the pelvic floor muscles just become so tight, so tense, it's almost like a traffic jam in your pelvic floor where you just cannot relax those muscles. And that is why that post-excision pain exists. And so in addition to that, endometriosis comes with a lot of comorbidities, which are dysfunctions and pain symptoms that occur in conjunction with endometriosis. So things like having hypermobility, very loosey-goosey muscle, nerve, tissue, ligaments in your body, which can cause dysfunction in itself. You can have hip dysfunction, you can have migraines, nausea, chronic fatigue, you can have fibroids, hernias, and all of these are what we call comorbidities that occur together with the endometriosis, which leave behind pain even after you've had the endometriosis removed. And so that chronic pain, the living in pain for so long, really turns the nerves on in your brain, and your nerves in the brain always think that I'm in pain, I'm just used to being in this much pain. And so the brain then in turn becomes very sensitized or hyper aware of the nerves and muscles in the pelvic floor. And this can cause higher pain signals and persistent pain even after you've had surgery. And so we really want to make sure that we're treating you after you've had surgery. We don't want to just send you home to recover after the surgery and send you on your way, but there should be close follow-up. And that's kind of where we as rehab physicians come in to work in with the muscles, the nerves, the tight pelvic floor guarding that happens with endometriosis. And so what we do, I'll just touch a little bit on how we can manage the nerve and muscular pain, and then I would love to open it up to whatever questions anybody may have regarding this issue. So there's kind of three realms that we touch on to treat post-excision pain with endometriosis. We use medications, we refer to pelvic floor physical therapy, and we do injections. And so the medications we use, we really like to target the pelvic floor. So your doctor may give you oral medications or a suppository medication. But essentially what we want to do is really down train those muscles that are so anxious, so tight, so tense that they are in turn causing bowel symptoms, bladder symptoms, sexual dysfunction. So the medications we use are used in order to help relax the muscles, really improve the blood flow to your pelvic floor, and really calm that inflammation down that has occurred after the surgery. In turn, we also refer you to pelvic floor physical therapy, which is a very specific, detailed form of PT that many women and males are not familiar with. And so pelvic floor physical therapists are very specialized in what they do. They do a combination of internal and external work to really calm that scar tissue down and create mobility in your pelvic floor and help you come up with a home-based program where you can continue to keep that mobility and keep that inflammation down in your pelvic floor after you've had an excision surgery. Because without really working those muscles and really keeping that blood flow going, the pelvic floor muscles are just like any other muscles in your body. If you don't use them, you essentially you lose them, and they lose their function, they lose their mobility, they lose their health. And so pelvic PT can really help in conjunction with what we're doing to treat you to create space in your pelvic floor, to calm the inflammation down, and to really help reset that mobility after surgery. And then we do injections. The injections are a combination of muscle trigger points to really help the muscle irritation and muscle hypertonia, and then nerve desensitizing injections to help calm those nerves down and to reset the pain signals on those nerves to really help those nerves fire in conjunction with the muscles. So it's what we call neuromuscular re-education. We really want those nerves and those muscles to be communicating well together because they've been in chronic pain for so long, they've been inflamed for so long, they've been dysregulated for so long, that we want to reset that pelvic floor with neuromuscular re-education. So our goal really is to guide you through post-excision recovery. You've had the surgery, you finally received the diagnosis of endometriosis, you've had it removed. So it can be very discouraging if you come home from surgery and a few weeks later, a few months later, you're in pain again. But just keep in mind that this is not abnormal. It's a large surgery, even though we call it minimally invasive. You know, there's scar tissue, there's adhesions. The surgeon is cutting things out and really getting in there to make sure that they clean those endometrial cells out. But unfortunately, all surgeries leave behind scar tissue and adhesions, and that can really promote that nerve irritation, the muscular damage, and the pelvic floor guarding, where you just cannot relax those muscles and calm the bowel, bladder, and reproductive organs down without a little bit of help. And so, the treatment is not forever. Post-excision pain can occur in flare-ups, but, our treatment is meant to really get to the bottom of the muscle guarding and the nerve irritation and to give you back your quality of life. So we generally say, 3 to 6 months is average treatment time. We like to treat you before excision surgery, and then definitely after excision surgery, you should be seen by your pelvic floor specialist and really get a good pain management plan. Our goal is to keep you out of surgery in the future. Our goal is to keep you off of heavy pain medications and narcotics, but it's really to create that holistic mobility in your pelvic floor that kind of helps to reset the muscles and the nerves. And so that is our goal in the post-excision realm of endometriosis. It's amazing to hear the things that patients are told after their surgery, that you'll never have pain, or you're cured, or you'll never need any treatment again. But unfortunately, that's not the case. And so if you feel discouraged after your surgery, definitely don't feel that way. You're not alone. And we do have a great treatment plan in place to help you regain that quality of life and be able to do the things you love to do after you've had an endometrial surgery. So thank you for allowing me to speak on this, and I'm going to go ahead and just respond to any questions that anybody may have. I haven't seen any pop up just yet, but if you do have a question, feel free to throw it out there and I will be happy to answer it. So I have a question. Why does the pain happen after surgical removal of the tissue? So that's a great question. So you've had that excision surgery, you've removed you've had the tissue removed, and it's kind of like the two surgeries that we were talking about are ablation and excision. So ablation is kind of like cutting the weeds off just from the top, and excision is really getting in there and removing the weeds from the root of the issue. So you can imagine that when the surgeons in there are really scraping away at the endometrial cells and trying to get that tissue out, they're going to create some inflammation, some pain, some nerve and muscle damage when they're really removing those cells. And that's bound to happen, and that can really set off the nerves and the muscles even more. Also, when you've been dealing with endometriosis for so long, that tissue being in your body for so long has left behind a lot of like an inflammatory environment. So even if you have the tissue removed, it's already irritated the nerves and the muscles around the endometrial tissue. So cutting that tissue out can leave behind pain because it's set off the nerves and the muscles and kind of created this environment of inflammation. And so that's where we really want to downtrain those nerves and muscles after surgical removal removal of the tissue. That was definitely a great question. Thank you. So another question, does the pain calm down post 12 to 16 weeks of surgery? Great question. So, your surgeon will tell you that you'll have a period of pain-free time after the surgery. And some of that is because when they're going in there and they're freshly removing the tissue, you may notice a period of time when things calm down. The hormonal changes aren't as significant because that endometrial tissue has been removed. And things are a little bit desensitized after surgery because of the medications you get during the surgery as well for anesthesia. And so the pain can calm down, 3 to 5 months after surgery. For some people it can be less, for some people it can be more time. But unfortunately, as I said, about 50% of women will notice that pain returns after that post-surgical period. And so when it does return, a lot of patients will think that they're having an instant recurrence of the endometriosis, and that's not necessarily the case. But it can occur because of the nerves and the muscles that have been set off by the chronic inflammation that you've had with endometriosis. So yes, you may have a period of pain-free time where the pain comes down after the surgery, but don't be surprised if the pain does recur after that period. Any other questions? And of course, if you have a question that, you don't want to ask right now, or you forget your question and you remember it later, you can always send us a message. You can go to our website, pelvicrehabilitation.com, and you can always set up a consult with a pelvic pain specialist who's near you. As I said at the beginning, endometriosis, 1 out of 9 women have it. It is a very common disease. It is unfortunately what we call an incurable disease, because even when you have it excised or removed, it is going to cause symptoms down the line, and it's something that can recur. However, the post-excision guidance that we talked about today can help you to kind of avoid major flare-ups and major inflammatory disruption to your pelvic floor after the surgery. I do have another question. Is the type of pain different during endometriosis and after surgery pain? So I think the question is the type of pain different when you have the endometriosis, before you have it removed, and after you've had it removed? That's a great question. So this can differ from person to person as well. So you may notice that some of your symptoms change after surgery. You may have bowel symptoms such as constipation or rectal pain before surgery, but if your surgeon removes that bowel endometriosis, you may not have rectal pain after surgery. However, you may notice that you develop some bladder symptoms after surgery, or you may notice you develop some sexual dysfunction after surgery. And so the type of pain can change after surgery. And this is because, again, the inflammation can spread anywhere in your pelvic floor. Removing the endometriosis from one part of the pelvic floor can really set off the nerves and muscles throughout the whole pelvic floor. So you may notice newer symptoms after the surgery, which can be really concerning for a lot of patients, that I didn't have these symptoms before surgery. Why am I having them after? But really it's because your pelvic floor has been guarding for so long that there's a certain point in which you stop differentiating parts of the pelvic floor, and you may just kind of perceive it as pain throughout the entire pelvic floor. But after having the endometriosis removed, it may be more localized to certain areas of the pelvic floor, such as your bladder or your bowel or your urethra or your hip. And that pain may become more apparent after excision. So it may feel like you're having a new type of pain, but your brain is just really able to differentiate where that pain is after excision, because the excision has calmed the inflammation down to a certain degree, but now it's setting off the muscles and nerves that have been chronically inflamed for so long. So that's a really good question. For a lot of people, the pain may be perceived differently before and after an excision surgery. I'm gonna hold off for about a few more minutes, and so if anybody has any other questions, these have all been great questions, and these are all questions that we hear every day, and we're happy to answer them for you. So this question says, how would that pain be? Sharp, dull, sore, or any other kind? Great question. So nerve pain is one of those things that can occur differently in each person. So for some people, nerve pain can present as cramping, stabbing, sharp shooting pain. It can present as itching, burning, irritability around the skin, superficially. It can also be deeper, like a throbbing, aching, dull pain. So that really depends on how your muscles and nerves are reacting to the inflammation. And again, the nature of the pain can change from before surgery to after surgery. For a lot of women, it can change from month to month during their cycles. The pain can occur between cycles and with cycles. And so the nature of the pain really depends on your body and how it's responding to the inflammation. And it can change from person to person. But no type of pain is the wrong type of pain, if that makes sense. So if you go to your doctor and you say, I'm having sharp pain during intercourse, or I'm having dull pain when I urinate, none of that defines whether or not it's related to the endometriosis. Your pain is your pain, and it's going to present the way it's going to present in your body, and that should not be a reason to disregard the pain. So any pain you're having should be brought up, should be mentioned to your physician, whether it's before surgery or after surgery. So I have a few more questions. Unfortunately, my symptoms are worse 7 months post-op. Do I still have hope of getting better? Absolutely, and I'm so sorry that you're still facing this post-surgical pain. We do have a lot of women who come in years after they've had surgery, whether it be 1 to 3 to 5 years after surgery, and they're still having that pain. Now, 7 months post-op, we don't really want to delve too deep into looking for a recurrence of the endo at that point. It's probably too soon for a recurrence, but 7 months post-op is a very typical time period to have post-excision pain, because the muscles and nerves have kind of had a chance to adjust to that scar tissue and inflammation, and now they're starting to act up again. So this is the ideal time to get into your pelvic pain specialist to see if it would be worth it to start a suppository to really calm those muscles down, to help improve the blood flow to that area, to find a good pelvic floor physical therapist who can really help you come up with a good pain management home program to really provide you that opportunity to recover after your surgery. So whether it's 7 months, 7 weeks, or 7 years after surgery, post-excision pain can occur at any time period after surgery. So you definitely have the hope of getting better. It's just a matter of really getting in there to tackle those nerves, muscles, and that guarding that your pelvic floor must be having from being in pain for so long. So I think that you should definitely seek care from a pelvic pain specialist and have a good program created where you can really get on the path of recovering after your surgery. So I missed another question up here. What's the best way to receive a diagnosis? It's been 3 years since my pain started, and gynecologists keep telling me I don't have endo or adeno, even though other things have been ruled out. So again, this is a very great question. Unfortunately, we are asked this question all the time. Endometriosis and adenomyosis are, for some reason, not at the top of diagnostic lists when you first go to see doctors. There's some research that says it takes about an average of 7 to 10 years for women to be diagnosed with endometriosis. They have to keep advocating for themselves. They have to keep fighting to get more tests to rule things out before they can actually be told, yes, this is endometriosis. So as I had mentioned, the best way to truly be diagnosed with endometriosis, really the only accurate way, is through a laparoscopic surgery. However, it's sometimes hard to advocate for yourself to have that surgery, and that's why a lot of physicians, a lot of gynecologists will order pelvic CT scans, MRIs, ultrasounds. These are all ways that may pick up on endometrial or adenomyosis lesions, but unfortunately, imaging is not very sensitive and specific to picking up on this. So you may have endometriosis, but the imaging may not show evidence of it. And this does not mean you do not have it. And so I think the best way is to really go back to your gynecologist and have them refer you to a pelvic pain specialist where you can really have good resources to get into having a laparoscopic surgery, or to even just discuss with an endometrial surgeon the risk versus benefit of you having a surgery if you truly think that you have symptoms of endometriosis. And again, just to touch on that, you are your body's best advocate. And so even if you're told I've had patients who have been told by multiple physicians that they don't have endometriosis, they don't have it, but you know your body best and you know your symptoms best. And so if you truly believe that something is being missed, then reach out to pelvic pain specialists, reach out to the endometriosis support groups, and really look for resources where you can continue to fight for yourself, because as I said, 1 in 9 women have endometriosis. So it is not unlikely that they are missing something on diagnosis. Those were all really great questions, and thank you to everybody who joined, and thank you to everybody who really opened up and asked those really intimate and difficult questions. Endometriosis is, it's becoming there's more awareness of it, it's growing, but unfortunately still we're having to really fight for our patients to be diagnosed and treated for endometriosis. And so if you do, know somebody with endometriosis, if you yourself have endometriosis, or if you have concerns about it, reach out to us and really let us know what you've been going through, and we would love to help you have the right treatment plan created for you, and hopefully have a better quality of life created for you, because living in pain is not normal. And so I do have one more question. I'm going to take this last question, and then if you do have other questions, you can feel free to send us a message through our account or through our email at pelvicrehabilitationmedicine.com. All right, so the last question is it harmful to skip periods with birth control in a way to mask or treat endo symptoms? Great question. So as you may or may not know, endometrial tissue reacts to hormonal changes. And so a lot of times the first line of treatment for possible endo is to start birth control, whether it's estrogen, progesterone combination, single, whichever one your gynecologist starts you on. That's a very common way to kind of suppress the hormonal changes that occur with endometriosis. I wouldn't say it is harmful, right off the bat, but I think it can definitely mask the symptoms and prevent you from actually treating the underlying issue. So a lot of women will suppress the hormonal changes and the symptoms associated with endo for years by being on birth control, and that may help in the here and now, but it's not truly eliminating the endometriosis. So when they go off of birth control, you may have a flare up of the pain. You may have inflammatory changes that really escalate at that point. It can mess with your fertility. It can really throw your cycles off and create more inflammatory issues in your body. And so skipping periods, suppressing periods, changing your hormonal cycles can mask the symptoms, but essentially it's putting a band-aid on the issue. It's not treating the endometriosis. All right. Well, thank you everyone for joining. It was really nice speaking to you all. As I mentioned, I'm Dr. Kapadia. I'm at Pelvic Rehabilitation Medicine in Dallas, Texas, but we have many locations throughout the country that we all see several patients with endometriosis every single day. And we would love to help you out, to help advocate for you, to help you really treat that underlying diagnosis of endometriosis and the surgical effects that happen after surgery as well. So feel free to reach out to us. Thank you for joining, and I look forward to speaking with you all again soon. Thank you.